This is NC Exclusive, and I'm Tolulope Adeleru Balogun. World Kidney Day is a day set aside every year to highlight the issue of chronic kidney disease. Most people don't know how common and harmful CKD can be. 1 out of 10 adult people worldwide have it, and if left untreated, it can be deadly. While early detection allows for disease care and management to help prevent morbidity and mortality and improve cost effectiveness and sustainability, kidney disease-related mortality continues to increase yearly and is projected to be the 5th leading cause of death by 2040. The burden of chronic kidney disease on developing and low-income countries is high. My guest today will take us through the conversation surrounding World Kidney Day, chronic kidney disease, and how we can do better for our health. Dr. Rotimi Badero is a fully trained, board-certified interventional cardio-nephrologist who has been recognized as the world's first and only board-certified interventional cardio-nephrologist. He has received several awards for his accomplishments in this emerging field of medicine and has been recognized globally for his contributions as one of the pioneers in the medical field. He started his medical education at the Obafemi Awolowo University in Nigeria before moving to the U.S. He has received several awards, including a congressional award from the U.S. government for outstanding medical career and service to humanity. He has been inducted into several prestigious academy societies, and he is a fellow of the American College of Physicians. He's a fellow of the American Society of Nephrology. He's a fellow of the National Kidney Foundation, a fellow of the International College of Angiology, a fellow of the American Society of Diagnostic and Interventional Nephrology, as well as a fellow of the American Society of Nuclear Cardiology. Dr. Badero, welcome to NC Exclusive.
Thank you very much for having me.
Let's start with your specialization, cardio-nephrologist. That's a very specific specialization inside a very wide range of medicine. So what exactly pushed you in that direction?
Well, great question. I wouldn't say that, I typically say cardio-nephrology chose me. I didn't choose cardio-nephrology. When I started out, I wanted to be a cardiologist, and things happened along the way, a lot of politics and things like that I don't want to get into. So I ended up doing nephrology first. And then when I was doing nephrology, I noticed that most of my patients were not dying from kidney disease, they were all dying from cardiac disease. And so that was my desire to go back and study cardiology. And then the opportunity presented itself. And then eventually I had to spend more time to do it. And it turned out to be one of the best decisions I ever made.
And I'm very sure your patients possibly agree as well. So now, for many, the connection between heart health and the kidneys may not be so obvious. So really take us through that. What's the connection between the heart and the work that the kidneys do?
So the heart and the kidneys, they're very connected. We always say the heart is the big brother and the kidneys are the little brother. So basically what happens is the heart is very central. It pumps blood to every part of your organ. And then this blood is used and utilized by all these organs to take oxygen and use them. Now, 20% of your cardiac volume goes through the kidneys. And there's a reason why it does that, because the kidneys basically what purifies and filters a lot of the things that go through the blood. So the kidney basically filters waste products. Every time we eat, we have waste products, the kidney filters that. The kidney also manages your volume. That's why we're able to have urine and pee out. And also when we take drugs, some of those drugs are excreted by the kidneys as well. Now, some kind of foods that we eat like protein, they generate acid. And also the kidneys what takes care of that acid because it stays in your body. It's very detrimental. So because of that intercorrelation, anything that happens to the heart eventually affects the kidneys. And anything that happens to the kidneys, for example, the kidneys are not able to filter out the volume or take out the urine, and then it builds up and then you develop heart failure. And then if the heart, basically, if you have heart disease and you're not able to pump a lot of blood to the kidneys, and the kidneys are not able to filter, then you have renal failure as well. So that's the relationship between both.
All right, so let's get more into the kidney health issues. Now, data says that 1 in 10 adult people worldwide have chronic kidney disease. Are there factors that predispose people to kidney disease, or it's just something that can come up depending on your lifestyle and sometimes environmental factors?
Very good. So let me elucidate more on the statistics. So in the United States, for example, 1 out of 7 people have chronic kidney disease,
Wow.
and that's 37 million people. And you have 1 out of 3 people at risk. That's another 80 million people. So we have like 120 million people, which is half of the population, a third of the population. That's a lot of people that have kidney disease or at risk for having kidney disease. And the reason is because the 2 commonest causes of kidney disease worldwide is diabetes and hypertension. And that has been on the rise even in America as well as in Africa. So diabetes is the commonest cause of kidney disease. It accounts for at least like 40%, and hypertension accounts for like 30%. So anytime you have increasing rise in hypertension and diabetes, obviously the kidney disease is going to also increase. The other thing is also because the awareness of kidney disease is not like when you have heart disease. So a lot of times when we realize that we have kidney disease, it's usually too late because you don't have the early symptoms like when you have heart disease, you have chest pain that tells you that something is going on. With the kidneys, you don't really know. The only time that you know, is when the kidney is really functioning very low, like around 15 to 10%. And when you're having volume buildup, your legs are swelling, you're feeling unwell, you have nausea, and you're vomiting, you're not able to eat. At that time, there's not much you can do to reverse the disease. So the awareness is very low, and that's why we're seeing a rise in kidney disease.
So I like the fact that you pointed out the numbers that are prevalent in the U.S. Some research puts the number of Nigerians who are living with kidney disease at over 20 million Nigerians. But we know that the issue with figures and data and statistics on the African continent are many. So if you had to extrapolate, if you had to look at especially the increase we're seeing in kidney disease presenting itself, what do you think the disease burden is here in Nigeria or across the continent as it may be?
Oh, I mean, if you look at the type of picture of events, obviously, I mean, I think the burden is higher in Nigeria. I mean, I think there's a lot of times that these things are not documented. I mean, if I wanted to project, I would think more than 50 million people are living with kidney disease in Nigeria, I'm sorry. I had a friend of mine who was a colleague of mine that died from kidney disease in Nigeria. And I've had to visit a lot of places in Nigeria, and I've seen a lot of people walking around with kidney disease and don't even know. For example, most African Americans or Black people, especially Nigerians, 50% of them that come and end up on dialysis don't even know that they have kidney disease. A lot of people don't know they have kidney disease. 1 out of 4 people don't know that they have kidney disease. The ones that end up on dialysis, 1 out of 2 of them don't even know that they have dialysis. I mean, they don't have kidney disease that would put them on dialysis. So I think in Nigeria, the burden is increasing tremendously. In fact, I think it's an endemic situation that's going on in Nigeria right now when it comes to kidney disease. And we don't have a lot of the resources to fight. We don't have a lot of places that have dialysis machines. And even when we have dialysis machines, we're not putting the fistulas, which are the grafts and things like that you need to get the blood out. And so a lot of people are using catheters, which are tubes that get infected. And these are very expensive. For example, a dialysis session, typical dialysis session can cost you 40,000 naira. And you need to do that 3 times a week. So you're talking about 100,000 naira, which is more than the average person makes in Nigeria. So a lot of people just go without getting this. And of course, also education is a very key factor. A lot of people are not aware of this situation and coupled with the cultural, myths and all this kind of things. So I would, to answer your question, I think that, the burden is much, much higher because some of these things are not even being documented.
So in looking at the research on this, there seems to be some kind of link between the fact that people of Black African origin seem to have a greater likelihood of developing kidney issues or chronic kidney disease. Can you tell us more about this? What makes people of Black African origin have a higher predisposition than the rest of the general population?
So yeah, that's a very true question. To answer, statement rather. The Black person has 4 times the risk of developing kidney disease. And even when they develop kidney disease, they don't know it. Even when they end up on dialysis, they stay longer before they can get a transplant. When they get a transplant, they don't do as well. A lot of the times, even when people end up on dialysis, the white population end up doing dialysis in the center, in the hospital. At home, compared to the ones that do it in the hospital, like the Black patients. So there's a lot of things. First of all, education is part of it. Risk factors like hypertension, we know is common in Black people. Diabetes, the kind of foods that we eat, Obesity is very prevalent in the Black population, and also some of the drugs that they take. For example, some of these over-the-counter medications are known to destroy the kidneys. Some of these medications that belong to the non-steroidal anti-inflammatory agents. A lot of Black people will take all these home remedies and things like that we've not discussed with a doctor, which ends up destroying the kidney. So when you put all those things together, that's the reason why. And some of the diseases, obviously, that are common to Black people also predispose each other with kidney disease. So when you put all those things together, I think that's one reason why Black people they have a more prevalent rates compared to the white population.
So let me take you up on something that many doctors here in Nigeria and across the continent have really been very concerned about, and that's about lifestyle changes. We're seeing Africans, we're not eating as many healthy or organic foods as we used to. There's more, of course, driving around. We're not walking as much. So a lot of people point to the fact that the way Africans used to live and interact with the environment has changed, and this is opening up Africans to more diseases that typically used to be called Western diseases. What do you think of this kind of concern in relation to chronic kidney disease?
Well, I mean, that's a growing concern. I mean, there was a study that was done, I think with the Jamaican population, that found out that, the Caribbean population, that found out that before they came to the United States, for example, the incidence of hypertension, kidney disease, and diabetes was actually low. And the moment they come to the United States, the same, people, you realize that the prevalence of hypertension, diabetes, and kidney disease goes up. And the only singular factor that you would notice is the westernization of the diet. And westernization of the diet comes with obesity, hypertension, and diabetes. So, and that's the same thing that's plaguing Africans as well, because now our diets are being westernized in Africa, and then you begin to see a lot of those things. And then let me just piggyback real quick to, the thing about the Black population. Historically, some of the formula that have been used to calculate kidney function, I've always taken race into consideration. And that's a travesty, because with the race, when you put the race in the equation, what it does is that it falsely elevates the function of a Black person as compared to the white counterpart. What that means is when your kidney function is high, falsely high, you don't seek medical attention. Your doctor does not refer you to a kidney doctor because it feels that you don't qualify for the stage of kidney disease that needs to see a doctor. And the white counterpart, because of that equation, they have a lower GFR or kidney function. We get to see the doctor earlier and get taken care of earlier. So this has been a problem. And I was one of the committee that wrote to the United States Congress to eradicate race as a function of equations to calculate kidney function. I'm glad that this is something that they're beginning to look at and beginning to eradicate that in all forms of medical labs and things like that. So.
And yes, and we've seen that's a growing conversation in the U.S., the racial disparity between treatment as well. So let's look at the theme for this year's World Kidney Day. And that theme is bridge the knowledge gap to better kidney health, basically looking at better kidney health for all. In terms of that gap, because you've mentioned it as well, that there's a knowledge gap that exists. What gaps do you think exist that we need to start plugging so that people can live better and healthier lives?
Well, excellent question. So, it starts from the grassroots, right? You start from the ground up. I mean, first of all, people have got to be educated. You need to take better care of yourself. You need to know, more about your health. You need to know about your health history. You need to know about your family history. Some of these things run in the family. You need to know what your dad or your mom, what kind of disease they had and things like that, and get yourself checked. That's the first thing. Healthcare professionals need to be educated. I saw a patient in my office a couple of days ago, and she's a nurse, came out here, and, she's a stage 4 kidney disease, and her kidney is functioning around, 30% of normal. And she's been seeing a doctor for all these years and never told her anything was wrong. So healthcare professionals need to be educated. Some of them think that when you're in stage 2 or stage 3, you don't need to see a nephrologist or kidney specialist. They can just handle it. I think it's better to refer earlier. So early detection is one of the key to preventing kidney disease. And we need to educate our healthcare professionals, the nurses, the nurse practitioners, the physicians, the primary care doctors, like when you do lab work and it's abnormal, let the patient go, refer the patient to a nephrologist right away. And then also in terms of the diet, we need to educate ourselves. We need to eat, we need to eat better. We need to stay away from a lot of carbohydrate diets. We need to lose weight. We need to exercise. We need to change our lifestyle. We need to stop smoking, not drinking alcohol and things like that. And also we need to address some of the myths. We come from a cultural society where a lot of people don't want to see doctors, or they feel the doctors are just, here to experiment on you. Or some people feel like, for example, high blood pressure can be treated and it can go away. It cannot go away. 90% of high blood pressure is essential. We don't know what causes it. And I've seen people who feel like, well, I don't need to take blood pressure medications. When you don't do that, you're going to have kidney disease. Diabetes, for example, is not going to go away. Once you get diagnosed with diabetes, you have to manage your diabetes. So we have to manage the myths. We have to educate each other. We have to change our lifestyle. And we have to keep putting it in the forefront so people get aware of this problem.
So in looking into kidney disease for this conversation, I found that there's some interesting research coming out linking chronic kidney diseases of unknown origin and climate change. And climate change is a really big issue right now. So some parts of the world, like Central America, are seeing an increase of CKD of unknown origin, leading researchers to believe that as chronic kidney disease, it can correlate to some environmental exposures to heat and humidity, and that it can then be driven by climate change. Dr. Badero, tell us more about this, because we're having conversations about lowering greenhouse gases and making sure that African countries get their fair share of support when it comes to climate change. But if we're seeing a disease that could possibly be brought about or even increase the incidence because of climate change, we need to be on the lookout.
Excellent. So this is a growing conversation right now. This is something that it's a hot topic. A lot of people, we have pundits on the other side, we have pundits on both sides. People don't think it's true, and some people think it's true. We do know that obviously environmental factors always play a role in the disease process, whether it's kidney, heart, or what have you. We do know that, for example, a lot of nuclear materials are being put out there now, because we're doing a lot of medical procedures, and some of these procedures have radiation and things like that. Maybe it's cancer and things like that are being treated, and these things eventually do affect your body in terms of exposure. And we also know that the chemicals in the environment, based on either dumping or the way we dispose of waste, and also people are talking about the ozone layer, being eroded and things like that. So environmental toxins exposure, eventually we know that it's beginning to affect human disease states and the human body. So, and the kidney is not any different, because like I said, the kidneys, its job is to filter waste. So anytime that you have exposure to something that is not great, the body has to find a way to get rid of it, and that sometimes it affects the kidneys. So just to answer your question, this is a growing topic. It's very hot right now. We have a lot of aficionados who are talking differently. So it's still left to be seen. We'll see what's going to happen eventually, but there's no one consensus right now regarding that. Yeah.
All right, so I think both of us agree that kidney disease doesn't get the attention it should. It's on days like today, World Kidney Day, that we tend to bring the focus there. And we see that it's typically low on the government's health agendas, with political commitments on non-communicable diseases basically concentrating on 4. That's cardiovascular disease, as well as cancer, diabetes, and chronic respiratory disease. But this is something that is said to be, or will be, the 5th leading cause of death by 2040. That's not too far from now. How do we change things so that kidney disease issues or kidney issues on their own, before they lead to chronic diseases, are part of the medical agenda of the government policies and health concerns into the future?
Well, I think that in the realm of social and medical choice, the rationality of access is vitiated by access denial. So, what that means is that, when you have social medical choice, the problem is access denial. When people don't have access to healthcare, especially a lot of people in the rural areas in Nigeria, things like that, they're not going to get good care. We have the resources, and I think it's something that the government has to put in the forefront. We have the resources, we have the technical know-how, we have the expertise, we have a lot of Nigerians that are abroad. Even the ones in Nigeria are doing a great job, So everything has to come together. I gave a talk in the World Bank some time ago. We're talking about Human Development Index, the HDI index, The HDI index in Nigeria is kind of low compared to other sub-Saharan countries. And if you look at those 3 components, one of those components is, access to healthcare. I mean, our standard of living is much higher than some countries like Ghana, but the HDI of Ghana is higher than Nigeria. And the only difference is if you have the high standard of living and people are dying early, it means that they don't have access to healthcare. Kidney disease in Africa and Nigeria affects most people in the 30 to 50 age group. That is the working class in the country. If people, and what the life expectancy in Nigeria right now is around 54. If people are dying before they even get to, get the best years of their working years, it's going to affect the economy. So this is something that needs to be put in the forefront for the Nigerian government. And this is a growing, endemic situation that we need to address. And the problem is we focus on the communicable and non-communicable diseases, and we're beginning to, lag behind in terms of kidney disease until it becomes a very, like you said, it's going to be the 5th largest cause of death in the world. So this is something they need to start focusing on and making sure that people have access to healthcare, because it doesn't matter if you put all the nice hospitals and everything in Lagos and Abuja and people don't have access to those things, it's not going to go anywhere. It's like, imperceptible distances with invisible angles. Like, you know what we call calibrated imperceptible distances with invisible angles? It's there, but it's not there. So, I mean, we need to focus on what's true and what we need to do and start making changes.
And I think this is a perfect place to end. I'll ask you this question. So you've done medical missions. You've also consulted with many African governments in establishing cardio-renal programs, cardiac centers of excellence, as well as training and skills transfer. But we can agree the gaps are obvious. And many people were even concerned that the gaps in the African healthcare systems would be a major issue with COVID. And somehow it didn't turn out to be as bad as many had predicted. But we will be preparing for a world that will see more outbreaks, such as COVID-19, and have to deal with more diseases, such as chronic kidney disease. For the African continent, what do we do to fill those healthcare gaps?
Well, I think it starts with our leadership, So we need to put resources because, like we know, it's healthcare, especially in Africa, unlike in the third, unlike in the developed countries, we don't have a robust, insurance scheme and things like that. It's still mostly fee for service. And this is something that is very, unaffordable for a lot of people because the average Nigerian is below the poverty level in terms of what they make. So if most people cannot afford healthcare, it doesn't matter even the healthcare is there, they cannot get it. So it starts with the government and to create ways in which healthcare becomes more affordable, standardized healthcare, subsidized healthcare, so that it becomes affordable to people in rural areas, And then again, we have education. We have to educate people, grassroots, the healthcare professionals, and ourselves, and the local government people, the chairman, things like that. We can start organizing things from the local government level to national level, state level, and things like that. But most importantly, is we have to make sure healthcare is affordable. The other thing that we have to do is we have to make sure that power is very central to anything that we do. The problem in Nigeria is power supply. So if somebody comes into Nigeria to set up a practice to help people and they cannot generate their own power supply because they're spending a lot of money trying to buy generator or diesel and all these kind of things, they have to transfer that money to the patient. Those patients cannot afford that. And so your practice is going to die an epileptic death. Nothing is going to happen to it. So power is very central to small businesses to grow. When you cannot grow small businesses and people cannot make money, people are leaving the country. Why? They don't need to leave the country because Nigeria has the resources. We have the brain power, we're very smart. But people are leaving the country. There's a reason why people are leaving the country. They should not be leaving the country. Like I said before, the democratic process in Nigeria has been stripped of its nationalistic, its puritanistic, and altruistic characteristics of 20 years. And we need to go back to that and start focusing on what's right and what we need to do. People don't care what you know until they know how much you care.
People don't care what you know until they know how much you care. Dr. Rotimi Badero, thank you so much for your time today. We know that you are going to be back in Nigeria sometime this year, so we look forward to talking to you more as News Central and seeing the work that you're doing.
Thank you so much for having me. It's a pleasure.
All right. Thank you as well. And as I said earlier, today is World Kidney Day. And as the doctor said, eat healthier, try to get exercise, stop smoking, stop drinking. But remember as well that the disease burden of chronic kidney disease is one that can affect not just you, but also those who care for you. it will be the 5th leading cause of global deaths by 2040. That's something for us to think about. I'm Tolulope Adeleru Balogun, and this has been NC Exclusive.